Hello, everybody. Welcome. We're going to go ahead and get started now. Next slide, please. All right, thank you. So what we were just listening to there was our podcast. You can find more information. We'll have up some links at the end of this webinar. So we'll just keep moving right on ahead. Next slide, please. All right. Okay, welcome everyone. We are very pleased that you could join us today for our 6th Project Firstline Echo session. If you have any IT difficulty during today's call, please chat directly with our chat monitor, Alyssa Long, in a direct message and she will assist you. Next slide, please. All right. Hello, everybody. My name is Kyle Mitchell. I am an educator, a veteran, and a storyteller. I will be your host for today. In addition, we will have Karen as our case felicitator. And also we want to know who's out there in the audience. So if you can, please go ahead and drop your information in the chat box for all of us to see. Next slide, please. All right, we're going to be jumping into the agenda today. So today's agenda includes our welcome and housekeeping, a brief introduction, and a small storytelling on my part. We will also have a case discussion, which will take place before today's lecture, as well as a fun Kahoot game after that. Finally, we'll describe a toolkit with available resources before wrapping up. Next slide, please. All right, so housekeeping. And here's a few small things. Please be sure to turn on your videos, mute your mics, and type your questions into the chat box. Please note that this session will be recorded for educational and quality improvement purposes. Next slide, please. All right. Project ECHO collects registration, participation, questions, answers, chat comments, and poll responses for some tele-echo programs. Your individual data will be kept confidential. These data may be used for reports, maps, communications, surveys, quality assurance, evaluations, research, and to inform new initiatives. The ECHO session will be audio and video recorded. Your participation confirms your consent to this recording. Recordings will be used for program quality improvement and potentially future training opportunities. If you are participating via phone audio, please announce your name and the location and put that information into the chat box, please. Next slide. Okay, please note that only the introduction and the lecture portions of this presentation will be recorded for educational and quality improvement purposes. No PHI, protected health information, is to be disclosed. All patient information related to the case discussion will be de-identified for presentation during this ECHO session, and only our case ID, ECHO ID, will be used. Please do not share any protected health information, PHI, during the ECHO session. Next slide, please. NCUIH is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public services for American Indian and Alaska Natives living in urban environments. NCUIH strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We hold conferences, webinars, and host an interactive website that helps to disseminate information and facilitate partnerships. Next slide, please. We would like to first thank the Centers for Disease Control and Prevention for their continued support. Project Firstline is a national collaborative led by the CDC to provide infection control training and education to frontline healthcare workers and public health personnel. NCUIH is proud to partner with Project Firstline. The contents of this program do not necessarily represent the policies of the AAHC accreditation body, OSHA, CDC, or HHS. It should not be considered an endorsement by the federal government. Next slide, please. Just a quick reminder that to complete a survey about today's session so that we can continue to improve our presentations. Here's a QR code that will lead you to the survey. Feel free to scan with your phones and complete as we go through the session. Each slide will carry this QR code at the bottom left corner of your screen for your ease of access. Next slide, please. All right. So if you have any fear about completing the survey, here's some additional insight to it. All right. So what kind of questions can you expect in our brief survey? The survey link will also be provided in the chat. So please feel free to fill it out at the end of today's session. All right. I believe Alyssa's going to drop that in for us. All right. Great job. Okay. Next slide, please. All right. So I decided to share just a brief storytelling. So the story comes from the Diné culture, which is Navajo. A long time ago, when Navajos first got here, where we were, there was tons of monsters everywhere. So if you can imagine Greek mythology, just monsters roaming the land. Well, we had two warrior twins, and those warrior twins, with the help of the sun, were able to rid the world of all the monsters, or so we thought. So there was one day when the twins were walking down, and they reached the opening of a cave, and they walked into that cave. It was very dark, much like a dark hallway without any lights. So they're slowly creeping down, and there was a pale light coming through the top of the ceiling through a crack in the rocks. And they saw before them a few individuals. The first individual they saw put their hands up and said, "Please, please, please, do not hurt me, do not hurt me. I'm a monster, but I'm necessary." And the boys said, "Well, what is it that you do?" And so they said, the individual said, "I am poverty. And without me, the people would not know to take care of themselves and to aspire for something greater." So the twins looked at each other, nodded, and said, "Okay, that's a good thing." And they went to the next, and they found another individual. And this individual was old and had gray and white hair all over, and said, "I am old age. I cannot be killed. You cannot rid me from this world, because without me, the next generation, the younger generation, will not be able to carry my wisdom and my teachings forward." So the twins nodded again and decided, yes, 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 we're good. And so there was a few others, but those are the two I want to focus on, because the topic of our webinar today is really talk about emerging and re-emerging threats. So in the very beginning, I talked about the first monster that they pardoned, poverty. And so through our teachings, through songs, stories, and prayers, we learn to uphold ourselves in the higher light, right? When our clothes start to get tattered, we know we need to buy clothes. When our hygiene goes a little awry, we know to, take a shower and clean ourselves and get ourselves ready. The other thing is with old age. And so when we think about where we have been within the past few years, and our world has completely changed in every facet, we do have to thank those individuals that the twins left, because we're able to now look internally within our groups, whether that be our tribe, our organization, our friends, and able to look into those who have a few years on them, those who might have some silver streaks, some white streaks in their hair, but those who are full of knowledge and abundance to share with us. And so as we progress today in our session, I just want everybody to know that daily challenges are there every day, just like the emerging and re-emerging threats that we have. And so how we survive and how we thrive is through song, stories, and prayers. But how do we strive and continue thriving in this new environment? Well, that's what you're about to learn in today's session. Thank you. Next slide, please. All right. So this is the anatomy of an echo. Please note that the anatomy of a traditional echo, which is an extension for community healthcare outcomes, for those who are new to Project ECHO, typically provides a lecture ahead of a case discussion. For today's session, we will review 2 cases with Mrs. Wonk and then move into our lecture with Mrs. Drummond. Next slide, please. All right, so now to dive into some learning objectives. Number 1, we're going to facilitate a global understanding of risk recognition strategies, reservoirs, and germ spread, and how it relates to infection control prevention. 2, we'll understand how healthcare workers can incorporate risk recognition strategies and infection control actions every day on the front line so that it becomes second nature. 3, apply these strategies through case discussions and problem solve how healthcare workers on the front line can be prepared to deal with emerging and re-emerging disease threats. Provide a toolkit on PFL training resources, content, and materials to augment on-site training. Next slide, please. All right, so we will now move into our case discussion. So I will hand over the floor to Nurse Wong. Karen, let's welcome up Karen, everybody.
Thank you, Kyle, for your story and for the kind introduction. I'm the SME for Project Firstline along with NCUIH. And next slide, please. I have no financial disclosures to share. Next slide, please. With the case presentation, I want to kindly remind everyone not to share any protected health information, and please unmute your microphones and share your videos at the segment for discussion. The recording will now stop in the next.
All right, thank you, Karen, for that, and thank you participants for participating and sharing that amazing information. We will now hear from Shay Drummond, who will provide us with a lecture with the valuable information on this topic. As a reminder, there will be a fun game after the lecture. The lecture will be conducted via the platform Kahoot, and you will be able to join by using your phone, notepad, or laptop or tablet. So please have a device ready to use for that. You will be able to select a nickname of your choice to play with, so you can rename anonymous if you choose. All right, so now I'd like to welcome up Shay Drummond. Shay Drummond is who has been an invaluable partner for many of our NCUIH events. Shay is a Project Firstline infection control subject matter. Prior to joining Project Firstline, Shay was an infection preventionist, quality management consultant for the VA healthcare system, and has frontline nursing experience in disease surveillance, outbreak response, and public health. I will now hand it over to you, Shay. Thank you.
Good afternoon, and thank you, Kyle, for that nice introduction, and Karen for driving some really robust discussion. We can go ahead and go to the next slide, please. And we will go to the next slide. Thank you. I have no relevant financial relationships with the manufacturer of any commercial products or provider of commercial services that will be discussed in the activities today. Next slide. So today's lecture is going to build on the case studies that Karen presented and to illustrate the importance of developing those robust preparedness plans that go beyond that checklist and a binder to becoming our daily processes of collaboration, reliable communication and coordination, as well as providing additional IPC tools for trainings, drills, and ongoing evaluation to ensure those positive outcomes are being met. Next slide. In 1863, Florence Nightingale, who many consider the founding mother of modern nursing, who was also a statistician and a social reformer, was asked an interesting question. She was asked, what is the first requirement you would have if you were building a hospital? And her reply was, the first requirement in a hospital is that it should do the sick no harm. I love this quote. I share this today because as the actions we take in preparing for emerging or novel infectious diseases, these are the same ones that we should be using every day in our healthcare setting to prevent that germ spread and hospital-acquired infections. Next slide. So today, September 1st, is this kickoff of National Preparedness Month. So I'd be remiss if I didn't take a minute just to talk about personal preparedness. September's the month. It's a call to action for our own individual preparedness. So that really includes gathering your own essential supplies, whether that's a 72-hour food supply, water, those medical supplies, of course, PPE for yourself and your household members, and don't forget about your pets as well. Another key part of your individual preparedness is planning ahead and having a communications plan. So I'm going to give like a little call to action here for everyone to take a little time this weekend with your family, if you have some time off, hopefully, and sit down and put together a little communications plan of how you're going to stay connected in the event of an emergency and how you're going to communicate in the event perhaps that we're even without cell phone service. You know, as we've seen with COVID and disease outbreaks, they happen at the local level, they happen quickly, they can impact our supply chains, they can overwhelm the healthcare system. So having that local preparedness and readiness done and having our own individual plans in place help us better prepare then to go help others in the event of a disease outbreak. Next slide. So on the other end of the spectrum from personal preparedness is the National Response Framework. This really is the foundational emergency management doctrine for how we as a nation respond to all types of incidents, including pandemics. Many of you may be familiar, it sounds like, from the comments earlier with the Emergency Support Function, ESF 8, which covers the health and medical annexes. The wheel to the right is from the National Incident Management, NIMS for short. And NIMS is a framework and guidance. It provides a common language as well as resources such as trainings, documents and forms. And this is for all levels of government, non-governmental organizations, the private sector. And this is so we can all work together to talk the same language and to prevent, protect against, mitigate, and respond to these emerging infectious diseases, as well as the recovery process that is necessary in any of these events. All this to say, these are large systems in place that you should be aware of that provide those mechanisms for coordination of training, response, and resources. The wheel represents the NIMS process, which was a key point that Karen brought up in the case studies, is the process. It's not one drill and done or one outbreak and back to business as usual. It's this continuous process and culture shift that we need to use in infection control actions daily to prevent disease spread. And that begins with identifying and assessing risk, as you can see in that top blue tab on the wheel. So risk recognition, it's part of everything we do in infection prevention. Next slide. As we saw in the first case study, the drills really served as a practical assessment and measure of the facility's emergency preparedness, and they used it to identify those gaps, understand and improve processes using pre-identified evaluation metrics that they laid out as part of their planning process for this drill. In this case, they were doing screening, isolation, hand hygiene, and evaluating those outcomes. And you can see they did identify and find those strengths and weaknesses. And I bring this up because an important part of any of these drills or education or training that we do is the after action process. This is taking those identified gaps and weaknesses and using those for the basis for our next round of trainings or drills to further build the healthcare capacity and resilience. Next slide. So in addition to drills, there are additional ways to build resiliency within our organizations. SHEA, the Society for Healthcare Epidemiology of America, outlines several other key preparedness pillars, and this is in their outbreak response training and toolkits that they have online for hospital epidemiologists, and the link is on the bottom of the slide. So a few examples I'll highlight as we move along here. Surveillance. How does your facility detect and report infectious diseases? And how is that communicated in a timely manner to those that need to know in your facility? Is your facility ready? Do you have isolation rooms? And who's responsible to validate the air pressure, for example, in that room? Is there adequate PPE, and do staff have regular trainings on appropriate use? Administrative controls. Does your facility have current policies and procedures? And do staff know where to find them? And are they viewed routinely and exercised so the staff can show you that they have knowledge and competency to demonstrate the ability to perform those policies and procedures? These are just a few areas that you can use to design simple huddles, in-services to review, or do quick drills to test and identify any potential gaps that may exist. The hardest part of any emergency response or just standard scheduled trainings is taking that time to debrief after you've done it, to collect that data, both quantitative and qualitative, and then analyze all the comments, responses, and put together that action plan that will guide you through any additional improvement processes in the future. Next slide. A couple of additional CDC tools I wanted to point out today that fit in our theme with emerging diseases is the CDC Health Network, Health Alert Network, and that we refer to as the HAN. So this is CDC's primary method, sharing cleared information about urgent public health incidents. And this is done in collaboration with our federal, state, territorial, tribal, and our city county partners. Overall, the HAN has over 90% of the populations of our states covered, and they use messages such as health advisories, health alerts, and info services now to over 1 million recipients. So if you don't subscribe personally or individually, you might want to go find out who in your organization is receiving the HAN alert, and then how this information is shared within your organization, and is it going to the people that really need to know this information. Next slide. COKE is another great resource that I really like, and this is geared towards clinicians. I know someone mentioned monkeypox and getting information on that earlier. And a few months ago, they did a stellar job of showing the unique aspects of diseases and diagnostic challenges with monkeypox via a webinar. So if you're interested in these sorts of things, you can go to the link on the slide and sign up, and you'll get notifications for conference calls and webinars, newsletters, and training opportunities. And it's just another really good tool to make sure that your staff is aware of. Next slide. This slide's one of my sort of favorite public health graphics. And it really captures some of our key takeaways today. It's a simple graphic, but it really illustrates that necessary planning process to not only deal with ongoing and emerging infectious diseases, but all areas of our daily infection control. The cycle really is a simple roadmap, and it starts with improvement planning, which is really what must be done each time. This is what makes this whole possible cycle to work, whether it's an emergent outbreak or you're wanting to evaluate a process improvement of a standard IPC program. This is where you're going to establish your priorities, you're going to identify expected levels of performance, and provide the standards for assessing the identified capabilities, such as isolation precautions or use of a negative airborne pressure room. Design and development. This is where you're going to come up with your trainings, your drills, your education. These can be your own, or you can use our Project Firstline tools that we've already created for you. Then there's conducting. This is where you're actually performing the training or exercising or doing a drill. And this is what's going to ultimately provide you with those objective assessments of gaps and shortfalls within your plans. Often it may be policies that need to be tweaked or revised, but this is where you're going to really address areas of improvement prior to finding yourself in another real world incident. And finally, evaluation. Again, these are the hard parts, because by the time you've either gone through a pandemic or put together a drill or training, it can be exhausting. But really, this is the piece you have to keep in place and not forget to do. This is where you're going to collect those lessons learned, develop improvement plans, and track corrective actions. You're going to want those for any sort of survey and for historical records. And this is where you're going to address the gaps and deficiencies that are identified and put together that corrective action plan that will then drive your next improvement planning cycle. So as we wrap up, I just want to reiterate that the case studies and resources discussed today involve all the same steps and processes used daily to recognize risks, know what actions to take that prevent the germs from spreading, keeping our patients healthy in our hospitals and our various healthcare settings. So becoming comfortable with these processes in our daily routines of healthcare will strengthen our abilities to respond to these emerging infectious diseases. One more point before we move on to our game. Drills and trainings don't have to be serious or boring. The more creative, the better. I heard escape rooms mentioned in some previous lectures that I was on this morning, and the Kahoot that we're going to do next is just a really fun way to reinforce education. So with that, let's move on to the game. Next slide. All right, as Kyle mentioned, there's some instructions here. So you can either scan the QR code on the screen or open your internet browser on your device, and you can join anytime in the game. Go ahead and join and put a nickname, or if you're bold and want to put yourself out there, go for it and let's have some fun. Next slide. So as this loads, I will tell you, it has a timer that counts down. And as soon as that timer is done, the first person that puts in the correct answer is going to get the most points. And then it will tally up each score for each question. And then at the end, we will have a winner. Whenever you're ready on the back end to start the game, let's go for it. As I said, people can join throughout the game as well. Here we go. What is the goal of infection control? To meet compliance metrics, to complete hand hygiene audits, to prevent people from getting sick, or to conduct annual bloodborne pathogen training. And the answer is to prevent people from getting sick. All right, looks like Skinny Bear is at the top. And we'll go on to question number 2. Where will you get cleared information about urgent public health incidents? Facebook, the Han, on Edna, or Twitter? And the answer is the Han. And just for disclosure, I do have an Aunt Edna, so next question. Oh, Mr. Hill, okay. True or false? Hand hygiene is the most common deficiency observed and reported in mock surveys and drills. And if you recall from the case study that Karen presented, hand hygiene was a common deficiency observed and reported in the drill. So true is the answer. Next question. Oh, Sunny. Okay, good job. Which of the following questions should you consider as part of risk recognition? Is it possible that my task will cause germs to spread from a reservoir? What other actions can I take to stop the spread of germs? What reservoirs are involved, or all of the above? And look at that, everyone got it correct. And it is absolutely all of the above. So everything we talked about today really talked and touched on risk recognition, just in different contexts of individual or systems risk recognition. All right. So, true or false? Standard precautions should be used for all patients all the time. And this is our last question, so thank you for hanging on. And more importantly, thank you for all the wonderful discussion that everyone brought to the case discussions today. You guys are doing amazing work, and I really appreciate all your efforts. These are without a doubt challenging times. All right, we're going to see number 3 is Mr. Hill. Number 2 is JA. And number 1, woohoo, Sunny wins the IPC trophy. Very good. Congratulations. All right. As always, feel free to reach out to us at Project Firstline if you have questions. I know we don't have time for Q&A, but know that we're here as a resource for you. So we're just an email or text away. So thank you.
Okay, and I know people are hopping off, so if you need to leave, please go ahead. But really quickly, we'd also just like to go over some a toolkit with some resources available to you all, and that will also be shared after today's event. So I'm Sophie, I'm a public health associate working on the Project Firstline team at NCUIH. Next slide, please. I have no relevant financial relationships with the manufacturers of any commercial products and or providers of commercial services discussed in this activity. I do not intend to discuss an unapproved or investigative use of a commercial product or device in our presentation. Next slide, please. So here's an overview of some of the key educational materials and resources that are available to you all. This includes training toolkits, videos, infographics, and more. All of the links listed on these slides will also be shared in the chat, as well as in a follow-up email that you will receive after today's event. Next slide, please. So here you can see what the CDC's Project Firstline website looks like. You can find lots of helpful educational and promotional resources here, along with information on Project Firstline trainings and partners. Next slide, please. You can also earn certificates and continuing education credits through the CDC's training and continuing education online platform for watching videos like the Project Firstline Inside Infection Control series that's created by Dr. Abigail Carlson. Next slide, please. And there are also many training materials that are ready to use through Project Firstline, including facilitator toolkits, session plans, slide sets, participant booklets, and more. Next slide, please. There are also many print materials and job aids available through Project Firstline, such as infographics on common body and healthcare environment reservoirs. Next slide, please. And there are also lock screens that you can use as screensavers to help remind you of common reservoirs where germs live. Next slide, please. You can also engage with interactive resources like the What's Wrong with This Picture activities, where you can test your infection prevention control knowledge by identifying problems in each photo that need to be addressed to reduce germ spread. Next slide, please. And there are also interactive infographics that you can engage with, where you can learn more about concepts like germ reservoirs and infection control actions. Next slide, please. There are also lots of educational videos available, such as Recognize Infection Risks in Healthcare that you're seeing on this screen, and we'll share that link in the chat as well as in our follow-up email. Next slide, please. There are also lots of short audio-free videos that you can watch and share quickly to digest and promote key infection prevention and control concepts. Next slide, please. And finally, there are animated GIFs that are available to help remind you of how to recognize the risks of germ spread related to body and environment reservoirs. And again, all of the resources discussed today will be shared with you all via email in one comprehensive toolkit. So I will now hand the floor back over to Kyle. Thank you.
Right. Thank you, Sophie. Appreciate that. And thank you for sharing all of those resources available. If you need a reference, we do have those in the chat. Just to wrap up today's session, if you have not heard our podcast hosted by Vicki Oldman, please take a listen. The links for the top three of our episodes will be shared in the chat, and you can also listen by scanning the QR code on the screen. Next slide, please. You can refer to the NCUIH events links for all upcoming NCUIH events, including the deadline for our Youth Advisory Council applications and the Project Firstline webinar coming up on September 13th. This will also be provided in the chat box. Next slide, please. All right, last but not least, again, the survey. So thank you all for sharing your time with us today. Please take our survey to let us know how we can improve. We will remain in the room for a few minutes to give you time to respond to the survey. Lamar, if you can just stay on the slide and give the individuals who haven't had a chance to complete it. Other than that, ladies and gentlemen, thank you for attending today's event. If you have completed the survey, please feel free to exit the Zoom. And if you want to hang out, you're more than welcome to hang out.